Hi, I'm Paul Silovsky, physical therapist and owner of Rebound Physical Therapy. And today I want to talk to you about why you would want to see a physical therapist after a car accident. There are over 6 million passenger car accidents every year in the U.S., and the majority of these are injury accidents. Now, what we most often see, barring the orthopedic type injuries with fractures where you have to have, a bone fixed or reduced, as they call it, or surgically fixated with the major car accidents where there's multiple injuries. Most often what we see are the soft tissue injuries surrounding the neck and the back or the spine. And they're related to three main areas. And that is, the muscular strain that goes with, a whiplash type injury, or actually torn ligaments or sprained ligaments around the spinal structures or other joints in the body, where the ligaments either get stretched or completely torn. And then the nerve injury that can occur from a whiplash type injury, from stretching, the joints out too far or taking the body to its extremes of motion and actually causing an injury to the nerves. Now, you can have all three of these things combined, or any one of them, and they can be of various magnitudes. You can have a very mild strain, which is a pull of the muscle or the tendon. You can have a moderate sprain, which would be a stretching or a partial tearing of the ligaments, not a complete rupture. And then the same thing can occur with the nerve damage. Now, you can also have inflammation around the nerves just from the injury itself, from swelling that occurs in the area, irritation of the joints, and continual irritation, particularly if you went into that accident not being in great shape anyway, or already had some pre-existing condition or weakness surrounding the spine or the joints involved. So that's just a general synopsis of the three most common things we see, barring, like I said, fracture or having something surgically fixated. Now, with physical therapy, it's important to get started early, even during that inflammation stage, even inside of the first few days, to help decrease the inflammation, because we have methods to help decrease the pain and inflammation in the soft tissues, in and around the joints, and to calm that nervous system down too. So getting started early to get the inflammation down and to move in what I call lots of little bits. It's really important following a motor vehicle accident to do movements in lots of little bits. Your body's probably not going to be able to tolerate a lot of excessive motion or immediate return to your previous activity. So you have to be coached through, what motions to do or not do, or how much motion is enough and how much is too much, right? Because you don't want to perpetually recreate the inflammation in the joints and the soft tissues. So here's the deal. Lots of little bits, getting guided through the movement and how to control the inflammation. And I keep it really simple and explain to patients, how to look at their progress following a motor vehicle accident, because it can be very frustrating when you start to increase your activity and your pain, really rockets up or takes off. And you're trying to control both the amount of motion and the level of pain, because it is often true that when you increase your activity level, that your pain might go up a little bit. But if you're gradually, ratcheting up and down, and your mobility or your function is increasing, your pain is decreasing, you're doing great. So that's why you need a physical therapist and, of course, working with your doctor to guide you through the process so that you don't create further harm, but you continue making incremental progress in lots of little bits. Increase motion, decrease pain, or increase function, and decrease pain is really the goal to get you back to normal activity. While you're going through that process, you're going to go through stages. The early stages, you're controlling the pain and inflammation and gradually increasing that motion. And then when you get, into that after that first few days or first week or two, into about the first 6 weeks, really, really important to be working with your healthcare professionals and a physical therapist, because that's when we can make the biggest gains, not only with inflammation reduction, but with remodeling and reorganizing the healing of those soft tissues and those joints, so that you maximize the healing and organize it in a way that as you lay down scar tissue, just like if you have a wound on the skin and you lay down the scab, you want to organize that in a way that you'll actually come out of it stronger than you were before, because we can give you the right motions, give you the right exercises, and give you the right education to organize the healing process as you progress, so you can get back to normal function, decrease that pain. And many times it'll take longer than that initial 6-week period, which is that real critical period, the first 6 weeks. Beyond that, particularly with muscle and joint injuries, it can take longer than 6 months. So we can continue to guide you to a totally recovered body, a reconditioned body, a remodeled body as far as the soft tissue healing is concerned, so that you don't have future problems, because it can certainly knock you out for a period of time of mobility or strength or function, so that you actually lose strength if you don't address restoring normal mobility and strengthening the areas that might have been weak before you even went into the injury, that need even more time and attention. And also to create a support system so that you can take strain off of your body. Because like I said before, if you had pre-existing conditions or a previous injury or some previous levels of weakness, you might have to work a little bit harder than somebody that was already fit when they went into the injury or the accident. So you need a physical therapist to help guide you through that reorganization and remodeling and rebuilding process. That's what we're there to do. So look, if you or someone you know has been in a car accident, get hooked up with a physical therapist quick. Give us a call. We'd be happy to help you do an evaluation and guide you through that process. You really need a coach, someone to help you progress so that you can get back to function and live a life that you want to live without as much pain. Look forward to helping you.